I'm Elisabeth Staudinger. I work for Siemens Healthineers and I'm responsible for the region of Asia Pacific.
And what is it that Siemens Healthineers are trying to do in the Asia healthcare industry?
Well, here in the Asia healthcare industry, we are, of course, continuing to promote and contribute our products both in the imaging side as well as in the lab. But we're also working on developing new approaches to collaborating with healthcare providers. And for us especially, the topic of digitalization is one we find extremely fascinating and interesting to explore.
And I'm sure obviously you work with a number of different partners across a number of different countries. Are there similarities in the questions that you're finding those partners coming in and approaching you with?
There definitely is similarities in those questions because the situation, even though the countries are quite different, but there is still commonalities in terms of having a situation where patients typically pay, where there is not a full coverage in healthcare system, and that comes with a group of hospital providers. In many cases you have private hospital providers who are facing quite similar challenges in terms of expanding and growing their business.
I suppose we talk about technology and digitalization now in a number of different industries. What do you think it is that is hindering the healthcare industry in digitalizing some of their processes?
I would say there is many spaces where things are moving, so I wouldn't emphasize the hindering so much, and there's extremely fascinating topics evolving around artificial intelligence, deep learning, utilizing big data and putting analytics on top of that. At the same time, probably the piece which is always a challenge is when you try to implement more complex IT infrastructures in a hospital environment.
And because I just have to ask, with AI and deep learning, lots of people are obviously, certainly now more and more, are discovering some of the maybe unpredicted originally consequences of AI and what they're able to do. Do you think there's anything for people to be worried about in terms of incorporating AI into their healthcare business?
From a provider perspective, I would not see too many concerns beyond, of course, keeping the data safe. I mean, this is, of course, a very key objective and something that must be secured and needs to be in focus. Once this is secured and taken care of, I think there is so much more opportunity than risk that I wouldn't worry too much in that space.
And so this is the first year that Siemens Healthineers have joined Hospital Management Asia. Hopefully you'll be with us again next year. And if you were, what would you be hoping that both yourselves, but the wider HMA community would be talking about? Where do you hope that we'll have gone in 12 months' time?
I do believe that that whole space of digitalization, which I've been mentioned already, is a topic which is here to stay, is a topic which will pick up speed, and a topic which will be on the agenda and probably the most prominent topic 12 months from now as well.
And so, talking about this digitalization and technology, have you got a sort of a technology of choice, or one that you think is particularly exciting that you would like to see implemented more and more across hospitals?
I mean, for me, this whole space of artificial intelligence when it comes to reading and interpreting radiology images is a very fascinating arena, because there is such an opportunity to improve the quality of the diagnosis that can be delivered. And being close to some of the developments going on, it's a very, very fascinating field.
And so to look a little bit more at Hospital Management Asia as a platform for Siemens Healthineers, what is it that's your objective for this year?
For us, the decision to participate in a very prominent manner this year was really the opportunity to have healthcare providers and management professionals in one location for 2 full days. For us, it's of course an opportunity to also speak about ourselves, but that's not the main aim. For me, the main aim is to connect, to network, to discuss, and to use this forum here to engage with healthcare providers from Asia.
And so, from your experience at the show so far, if someone was considering coming next year, what would be one of your top tips for them?
So difficult.
Okay, if you're not sure.
It always depends on, are you now looking more from a sponsoring or from a participant side?
It could be from a sponsoring point of view, so that it's more relevant to your experience so far.
So if you look at the sponsoring piece, I think it's always, you need to be clear about what you want to achieve. And then decide what is the best way of getting there. Is it, do you want to be a top sponsor? Do you want to be present in more the breakout sessions and contribute content-wise? Do you want to go for the branding? And I think there is multiple opportunities to realize different goals. So it really depends a lot on what you're trying to accomplish. And for us this year, it was really, like I said, it was about positioning the brand, getting our name out, and even more so about connecting with the people here in Manila.
And so, one final question. If there was a particular healthcare organisation, or maybe it's even a particular person here in Asia that you would love to speak to and have a conversation with, who would that be?
There is many outstanding individuals here, so I believe being here and having many of those very interesting and very engaged and active people in one space is a great opportunity. I would struggle if I had to single out that one person to say, well, this is the guru and the only and most relevant one for me.
So, final question. Are Siemens Healthineers involved in the awards of Hospital Management Asia? And if so, what sorts of projects did you enter into the awards?
This year we were not really aware of this opportunity, I have to say, so no, we did not contribute this year at all to that part.
My final question then. Are there any sessions over the remainder of today or tomorrow that you're particularly looking forward to, and why would that be?
Actually, there is more than I'm able to join. Just looking through the program, I think there is many interesting bits and pieces. What I'm always interested in is hospital management, managing operations, but also the leadership dimension, which is important and relevant to people managing hospitals here in Asia.
Well, I hope you get to have those conversations and go to as many of those sessions as is feasibly possible with the time. That's perfect. Thank you so much.
Thank you very much.